very quickly, like 4 swipes, 3 swipes, it comes out.
I feel that stretch on the front.
In the past, you've had stiff, sore neck.
I have had some stiff and sore neck, definitely for sure. Neck, upper back, shoulders. That's what prompted me to go to the chiropractor the first time back. I'm thinking it was October.
Okay.
Is my guess is when it was.
And
October, November.
Has there been any imaging they take of your X-rays or MRIs? Nothing. Okay.
No.
All right. Well, that's having symptoms isn't a requirement to go to your dentist, right?
Yeah,
It's like
yeah.
same thing with your spine. We don't wait till it's actually better. Same with your car. You wait till something happens. It's going to be more expensive than being proactive. And I'm glad you're here. Have you had any? I'm just curious. Have you had anybody, explain discs or how our spine works to you? Has there been much education, or just maybe through my videos? Or
Your videos has been the most I've got.
Okay, well, we'll do a little continuation of it, but similar to your teeth, there's a certain alignment that your teeth need to be in for longevity, and the same thing with our tires in our car. If your tires aren't on straight, they wear out unevenly, and if your teeth are correct. The spine belongs in a certain alignment. We are born in a C shape, so they call this the thoracic primary curvature, and we don't have a curve in our neck, and we don't have a curve in our lumbar. And the first, and you said you have 4 kids, so congratulations, but your baby in the first year of life recently developed. If you hold your head up against gravity, it's natural for the neck to actually begin to be curved. And that first lordotic curve starts in the neck, a 45-degree arch that allows the weight to be evenly distributed over all the segments. And then hopefully, they crawl on their bellies, and then that induces the lumbar curve. And at about a year old, almost all of us look like that from the side, wherein we have a nice curve in our neck and a nice curve in our back. And the purpose of the curve is not just for weight sharing, but also to keep some of the weight off these discs. These discs are the non-sensitive cartilaginous spacers in between the vertebrae, and they are actually hydrated through mobility. So if they're constantly compressed, wherein if you don't have a curve in your spine, they're sandwiched all the time, they start to dry out, they start to bulge out from injuries, and it's easy to see that the size of that hole is dependent on the height of that disc. And that's one of the things you can see on x-ray, not at our age, but into your 50s, you'll start to see drying out of the discs, which is one of the reasons I'm not a big fan of young x-rays, because you actually can have a swollen disc on x-ray. The disc can be injured, but we miss it on x-ray. That's why we have to get an MRI to really see how the discs are doing. But that's one way we can use an image to see how your spine is aging. You're 30 years old. I would hope that the spine looks like a 30-year-old spine. What we would sometimes see when the alignment changes, if the curve in your back goes straight, the work starts to get predominantly sent down to these last 2 segments in the lower back, and hence why L5 and L4, about 99% of back surgery happen. These 2 guys here in the lower spine, and then because of the loss of curve in the neck, the last 3 guys in the lower neck predominantly have all surgery. And so the current medical and chiropractic explanation for why we have disc injuries is something like wear and tear, and you're old. And I go, well, how old are all the other discs that are not injured? And so because the whole spine is of the same age, it's silly to say that disc injury is happening because of wear and tear, when it's more about certain parts of the spine were overstressed. That's based on the alignment. And well, how do we lose our lumbar curve? Well, we sit predominantly. I know you said you travel agent, you do a lot of maybe desk work and work in a computer, which really has only happened in the last 130 years. Have we had jobs where a large percentage of the population can be sedentary? There's only 2 things that have symptoms. You can feel the disc hit the nerve, and that causes a symptom down the leg or down the arms,
tingling or something,
radiating. Or back pain is predominantly what we call facet syndrome, is the knuckles. So the holes change in size. If we bend forward, the hole the nerve goes through gets bigger, so it actually can delay the appearance of a neuritis by having bad posture. You have to wait till these discs get injured, so it pushes the can 10, 15 years down the road, and you actually take the weight off the joints when you bend forward. So the joints are actually happier with bad posture temporarily. Muscles get tight, and so that usually be the first symptom you describe. I feel stiffness and tension. That's because the joints have stability by their overlap. It's like a handshake. The more the surfaces are contacting each other and overlap, the more strength they have. The more we separate, the more the muscles have to work to hold everything together. And so a lot of doctors and therapists are teaching a core strengthening narrative, wherein Your spine will be healthier if we strengthen your core, and while I agree that temporarily you can strengthen and stabilize a spine with a tight muscle, I don't see that being a good long-term thing. I want your spine to be in the right alignment and the stability come from your alignment, not because you have Hugh Jackman Wolverine contracted muscles holding you together, even though it's impressive looking. Your ear, for instance, should be over, your ear hole should be over the center of your shoulder, and I can already see, the head's gone forward, and that creates muscular tension based on your posture. And so you can rub the neck, we can adjust the neck, but if the head stays forward, the orthodontistry hasn't been done. We have to fix the alignment, and that took chiropractic about 100 years to figure out, that we have to mirror image stretch. We have to actually take you to the opposite position, hold you there for your body to want to be in the middle. And so if our body's spending hours and time spent here, we have to counter stretch. Now to safely do that, we have to make sure the whole spine's working as a team. And that's what the table work is for, is prep for the stretching. And we're dealing with about an inch and a half forward. So I'm looking at the center of your shoulder. And the shoulders are a little rounded forward, so that hides it a little bit. If I pulled the shoulder back, it'd become a little worse. But the point is that the head, the tension in your neck will be perpetual because your static posture is here.
Just a little bit too,
This is where I think
No.
center is. Yeah, go ahead.
Yeah, no, I went and looked in the mirror after I saw you explain that in one of your videos. I'm like, oh, no, I have it.
It's not our fault. It's not your fault. It's the fault of our world not guiding us into brushing our teeth.
Yeah.
That having this posture, now many things happen. Your hamstrings get tight. It's an easy test for people at home. They can, when you're standing upright, the weight should be on your heels. And so if you put your hands on your hamstrings and then shift the weight onto your toes, you'll feel your hamstrings contract.
Yeah.
Right? So everybody always has these tight hamstrings, and I'm going, it's because their head's forward, right? And so the answer isn't to stretch the hamstrings. Does that make sense? The answer is to get the posture upright so that the hamstrings aren't tight to begin with. Sorry, my hands are cold. But if your back is supposed to be supple. Does that make sense?
Yeah.
If this part of my back is really stiff, right? Now it's stiff.
Yeah.
If I bend, it's not bending where your hand's placed.
No,
it's going to bend at the bottom,
Yeah.
right? Hence where everybody. So if your middle back is bending, it's unlikely that you're going to have a lower back that's overstressed,
Okay.
right? It's
I don't know
unlikely.
if I've ever felt a back bend like that. I've never
Well,
particularly felt it, but
I've
it's
been
interesting.
adjusted a few thousand times.
And it was after watching your videos and starting to understand, everything you said made so much sense. I was like, hey.
Well, my profession has gotten so focused on symptoms. We're so zoomed in on a symptom that we lose sight. We don't take 3 steps back and go, oh, the reason why that's happening is because this is not, right? I zoomed out on you. We call it global postural analysis, right?
Yeah.
This is why some people might ask, well, why isn't he taking x-rays of them? Because I'm not zoomed in on the segmental analysis.
Yeah.
Chiropractors were trying to show something objective. Here's your x-rays, and look, that vertebrae is rotated over here, and that vertebrae is rotated over here, and we're going to try to, first of all, it's not possible. Sorry, it's not possible to change the position of a vertebrae by adjusting it.
Yeah.
Only stretching can do that. And then secondly, these bones are fluidic. They're constantly moving, and we're taking a static picture of a dynamic structure. And then the last thing is that the body, if it truly is crooked, the body does that intelligently. Your body purposefully did it, usually as a result of an injury or your posture. Or if I break my right leg, I'm going to shift my weight over here as a way to get out of pain. So your body does the same thing with the segments. And so that took chiropractors a while to zoom out and say, stop looking segmentally, start looking globally at the whole spine. And that's what I did to you today. I looked at your global posture and said, this is not set up properly. And so symptoms will be an inevitability. And so we're not supposed to wait till 50 when you have radiculitis and sciatica. All right, just fix me head. All right, yep. I'm gonna help you do a little sit up for me. Take a deep breath in. Head back for me. Let all the air out. Just relax your chest. There you go, let it go. Beautiful. Take a deep breath in. Head back. Let it all go. I got you. It's okay. I'm not gonna hurt you. Exhale. Good. Deep breath in. One more. Chin down. Exhale. Let it go. Yeah, right there. Good. Got it. Yeah. Get the idea, right? Why'd you do that? I'm checking. Do those piano keys move? Because I know if these piano keys are moving, it's unlikely that you're going to really wear out the lower back, right? Where we already know where most surgery happens. purpose of this adjustment is to loosen what we call the sacroiliac joint down in your glute. You're gonna turn your head towards me a little bit. There you go. Gotta take a deep breath in, relax your shoulders, relax your hips. Breathe, breathe, exhale. I got you, not gonna hurt you. I got you. Good, let's go on this side for me.
In the videos, this works fine, but when you're doing it, it's like, am I going to fall off?
Nobody falls off.
I know.
My dad would jokingly say my whole life, if you fall off the table, you get free chiropractic care for life. I'm like, Dad, would you stop saying that? People are going to throw themselves off this table. Take a deep breath. Exhale. Good. Right, face up. All right, real easy. I got you. Just trying to loosen this top guy a little bit. Beautiful. 24 vertebrae, only 2 got names, the top 2, and they got names because they're more important than all the rest. And if we have a functioning atlas and axis, then we know the lower neck's not going to be too jarred up, too stressed out. So I'm just checking how well this joint works. There you go, relax here. The goal is not to see how many pops I can get out of your spine. The goal is to balance your spine. I'm trying to feel this knot right here.
Yes.
Yeah, it's not this. You weren't born with this. This is an add-on. This is an aftermarket addition to your spine. That if it remains,
that's what I thought. I thought you'd start finding stuff that I didn't know was there.
yes, sir. Yeah. If this remains here, it's highly likely that this area underperforms, underfunctions. Which, if this area underperforms, then somebody else has to overperform and overstress, and that almost always is C5, 6, and 7, where almost everybody at home watching, I know somebody with a C5 disc injury. I mean, I got my hair cut today, and the guy cutting my hair was like, yeah, I have a C5 disc injury. Everybody. Is anybody noticing that it's the same couple vertebrae getting injured? Yeah, these are the roots of your neck down here in the shoulder. They're stressed at a higher level because of the posture. As the tree leans over, think of the trunk of a tree like your neck. As the tree leans over, the roots on the opposite side start to elevate and come out of the ground. These are the roots right here. And we can massage this for hours. It will never go away until you get the ear over the shoulder. We have to change the posture. But we also have to make the spine limber so we can change the posture, right? So why are you rubbing me so much? Because I got to make you soft. I can't reshape hard clay. Your neck belongs, as odd as it might feel, way back here. So we overcorrect. We're going to ask for an overcorrection so that you'll be in the middle. And that's what we call mirror image stretching. We take you to the opposite of what you're used to, and then your neck will, the more and more we do it, the more and more your neck will comply and want to remain curved. There was a huge knot on the right side.
Oh, yeah.
There's a little tiny one there, but it's about a quarter of the size. Right, I understand. It's okay. I wake up in the morning, I fix necks, and I go to bed.
That's interesting.
Your neck's not on straight. Your head likes to tilt left more than it likes to tilt right. But yeah, this is going to be over. This is more stress down here.
And I would have just said it was because I'm left-handed.
Right, but it's this. You feel the stress here? The stress here is more than actually the right, because this is where your neck is functioning something like 60-40. The left lower is doing a majority of the work. So the journey is going to be to get off the left. We're going to try to get off this left side and throw the work back onto the right. Just like peanut butter and jelly sandwich. Nobody wants a peanut butter and jelly sandwich where all the peanut butter's in one clump. All right, somebody out there does. But okay, most people want it spread out, right? You spread it over the whole surface area of the bread. In the same way, the work of your spine needs to be spread over more area, and so no one vertebrae is taking all the stress. And that's what I do for a living. I spread work. I spread it over a larger area. There it is. Okay. That, I'll rub the left in a second, but that does not exist on your left side.
No, it doesn't. Yeah, you can tell it doesn't.
There's already a mark coming out, and this is what we want to. The mark is the evidence of the lactic acid contained in the stiff area. So because it's been injured and now avoided, the tension in here is much higher than it's supposed to be. So it's producing a lot of lactic acid, inflammation, soreness, pain. Ow, it hurts when you touch your head. I understand. Yep.
Definitely feel that lump in there now.
Hello. I was 13 years old. My dad said, "Get in here and work on my neck." Okay, Dad.
Is he still practicing?
He sure does. Yeah, he's doing good. Yeah. Let's try. All right. So, Dr. Ed's greedy. He wants more. Chin up. There it is. Wow. You all right?
Yeah.
Yeah. That was the same bone I adjusted earlier, just a little bit more closed, like that handshake I was trying to show you.
Yeah.
And if the weight's on the joint, then we know the weight's not on the disc, right? So why is that necessary that the joint closes so much? The disc doesn't regenerate, joints regenerate. That's the answer. Okay. The reason why you can't have all the weight on the disc is discs don't replace. They're like the enamel on your teeth. There's only so many cycles of stress that they can handle before they've run out of life. And so we're trying to extend the life of the disc. Sides about. When I look at your back, if I put a marble on your back in the middle, it would roll off to your right because this side is more elevated here on your left than it is over here. And so, again, the neck tilt, so because your head's tilted away from this right side, it's elevated your left shoulder, which elevates all these ribs. And now this being elevated is going to throw the work to the right lower. We can know where your spine is going to wear out prematurely based on its alignment. Okay. It costs double for me to be quiet, okay? It's discounted if you let me talk. Okay, all right. Just fix my head. Right in here, yeah. Oh, boy. The same thing with the right side of your neck is right here, and this is all low, just like the left side of your neck. It just dominoes its way down to your feet. There we go. Maybe ping pong's better word. Ping pong's its way down. Okay. All right. Right there. Oh boy, yep. That's a nice spot.
I'm feeling it.
Who put that there? That's a nice nugget. Okay, all right. I'm just scanning here. It's like a piano key that doesn't want to move, right? You feel it. It's a vertebrae that doesn't want to.
Yeah, it bumps when you go over it.
Right. That's my job. Okay. Yeah, yeah. Mm-hmm. There is no normal soreness, there is no normal tenderness, there is no normal door dents, there's no normal knots. These are all things that happen in our lives. And they get stored back here, and I get to open up Pandora's box and, oh, what's in here? Who put this in here? All those times somebody told you to walk it off, kid. Your body didn't walk it off, it just got stored. Mhm. And don't mistake me, this side's elevated too. It's just less elevated than the left. So
Yeah, well, I'm
both
noticing about for the top is definitely more sore on
correct,
this
yeah.
side.
Both misaligned. But,
Ah,
mhm. Line back, there you go. Ooh.
I've never felt things moving in there like that.
Yeah, I mean, very quickly, like 4 swipes, 3 swipes, it comes out.
Interesting. I actually wasn't expecting it to be that fast.
Yeah, it's already dark. You're probably also not expecting it to feel this good. This is the easy part. The elbow is the hard part. You know, I'm not pushing that hard.
Yeah.
It comes out with very, very gentle, light scraping. The mark comes out as evidence of what's inside. People are like, "Oh, you're just busting his skin up." I'm like, I'm just almost the weight of the tool. I'm barely pushing
I
hard.
know, no, it's hardly any pressure at all.
Yeah, it's very light. What's happening is the blood comes in here and grabs a hold of all the soreness and lactic acid that's accumulated and trapped in these tense areas based on what I was trying to show you earlier. Right? This area got tight when my head went forward. And so me just doing this isn't going to solve it, right? It can't change it. Still, my head's still forward, Ed. You haven't done anything to stretch my head back. I know, we'll do the end. That's why we have to do the counter stretching. But if we can't stretch well if all this inflammation's back here, because we run into it and ow. So it's a handful of visits to get the spine limber and clean so that we can do it properly. I'm gonna put that arm behind your back again. It's okay. There you go. Okay, keep that there. There you go. Yeah, these ribs. It could all be this, but I think there's been a something hit you on this left side. You know, collision or a brother kicked you or I don't know, fall out of a tree.
I don't remember anything specific, but I
Okay.
grew up on a farm, so
Who knows?
and then worked on dairies for a while, so whatever.
Right, I get you. I just
Wouldn't be at all surprised if there was something.
I'm getting some old stuff. Like some of these marks are a little bit like they're like brighter red, and then some are like real, almost like purplish or bluish a little bit. It's like tells you how old the stain is, how old the injury is, how long it's been there.
Yeah.
Is also evidenced by the color of the mark. All your oldest stuff is all trapped in there, and I think it's going to shock you when I take a picture of you. It's pretty remarkable. I didn't know that was there, Ed, until you touched it. Right, okay.
No, I grew up on a farm in Kansas,
Okay.
Wonderful.
and my wife grew up in North Dakota.
Oh,
Cool.
wow.
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 My sister was up in Dickinson for a number of years.
Yeah, I think I heard her mention that on her channel. Yeah.
She was up there.
It's cold up there.
Yep. Yeah, no, we've been in Vermont now for 4 years, and this is the first time we've went actually anywhere in the winter at all. So
Okay.
I got you. Like I said, this is just real gentle gua sha. You just,
yeah,
it's like the first pass with a vacuum cleaner on carpet. It's that first pass that you go, somebody spill some Cheerios? Yeah.
And Wake is gonna be like, oh my gosh, it is
What
really
did he
purple."
do to you?
she probably will because I never told her anything that about that about the Gua Sha, so she will be shocked.
Ed's face is like, oh.
I mean, right what you were mentioning earlier, like right here, these are the roots again of your neck.
Yeah,
I mean, they don't get a break much. That's what I'm trying to say. They're supposed to contract when your head goes forward. They're supposed to relax when your head comes back upright. But because your head stayed forward, this area doesn't ever turn off. Like the engine idle screw has been turned up too high. And you're idling at 3,000 RPMs instead of 500. You know, and so the amount of exhaust coming out of this tissue, the amount of lactic acid the cells produce is much higher as a result. Right there. The tissue cleans itself through mobility, so you won't need this if the posture is correct and the vertebrae are moving.
Yeah.
It's really a result of the congestion of the posture, and as you address the posture and the mobility, the marks stop coming up.
yeah.
They're a result of injuries and posture. And then yes, if we're putting a lot of stress on our tissue, then yes, we need to be, cleaned more often than a person that's not. But all right, wow. I got you, bud. There we go. Relax now. Relax. Breathe in deep for me. Try to relax your back. Exhale. Push your chest forward a little bit. Relax now. Yes.
I feel that stretch on the front.
Get the idea? Right.
Yeah.
It's actually the front that needs to be stretched.
Mm-hmm.
Because as much as this needs to come together,
Yeah.
the front has to open up, and that's what we haven't altered yet. But I want to compress, taking you into extension and adjusting this. Put your arms back down for me. Okay.
Is that the green roller?
Yes, sir.
Interesting. It feels much flatter than I imagined.
I'm just seeing if I missed any.
Yeah,
Not that well.
I could definitely feel that when you were
A lot of stuff in there, bud. Again,
on the Gua Sha.
I'm gonna get a toothbrush.
Well,
Try to,
actually, no. That spot right there.
so on,
I
on
could-
your right.
I could feel
Okay.
when you were doing it.
Yeah, there's some old injuries in there we gotta resolve. Have you on your back for me? I'm the joint whisperer. Okay, I talk to them. Talk to me, joint. What have you been through? Okay, all right. Okay, good. Okay. All right, fair enough. Let me see here. All right, I don't feel any swelling or anything. On the outside, how sore are we?
No soreness. I just noticed that I don't have the same mobility in that one as I do in the other.
But it's not too sore in here.
No.
Okay. I got you. Easy, actually. How'd that feel?
Good.
Yeah. Press back on your elbow with my elbow a little bit. Press back. A little bit more. There you go. Press back, press back, press back. A little bit more, press back. Okay. Kind of middle upper neck. I don't want it so high that your chin is down, right? And I don't want it
Right.
so low that we're in the lower neck. Kind of as high as we can, but your head is still going over the device, and you press
Okay. No, I can
It
definitely-
doesn't seem to work as well as your thumb. Correct. Because if it worked as well as my thumb, I wouldn't have a job. Okay.
Yeah, no, I can
But-
feel it pushing into right into that.
Yes, sir. Yeah,
Where it
it's
needs
just
to.
it's an emulation to give you something at home that you can use to
Yeah.
help hold that vertebrae. And like I said, when you tilt your, all right, so biomechanics, when I tilt my head left, or if I rotate my neck left, the bones all go to the right.
Yeah.
Okay.
Okay.
So when you're looking straight forward, the bone's sticking out, as if your head was tilted, when in fact your head's not tilted. You understand?
Yeah.
It's like you got your handlebars straight, but your tire's crooked.
Yeah.
I want them to line up at the same time. So we have to overcorrect to the opposite way. And then you put your hand back down. But main thing is just initially what you'll do is you'll press to get your head to sink in. There we go. All right, hold on. Come on back. Yep. Come on back. I got you, bud. All right, knees bent. There we go. Arms up. There we go. Oh, boy. Okay. Okay, Ed.
That's a stretch.
Okay, put the arms aside. Yes, put the arms over there. There you go. Breathe. Let the shoulders relax. Relax the shoulders. All right, we got work to do. Okay, we got a mold. If this was easy, you would need to be here. You know, how many things that we've never done are you good at? Not many, right? And so we're introducing a position that your spine is not used to in the opposite fashion of what you're used to, right? So we're taking it the exact opposite. You're a positive 2, I'm taking it a negative 2. We're going to the opposite position.
Yeah.
And so the ability to do this easily is the essence of your journey with me or a person like me in your life. If this was easy, you would need to be in my office.
Yeah.
It's that simple. If you can get on a neck down roll and a back down roll and you think it's a joke, you don't need to go to a chiropractor. If you get on and go, ow, or I have, for instance, right now, I don't know, 4 or 5 inches of material behind your head. Do you, that make sense?
Yeah.
This shouldn't be here. So I could do it with 6 blocks by my head. Okay, that's great. But I meant no blocks. I meant head on the floor.
Yeah.
And right. So it's,
And as far as the position,
well, your range is from the bottom of your shoulder blades to about here. I don't want to go down to your lower back. We're stopping.
Okay.
It's kind of this whole middle back region.
Okay.
Kind of similar to where you felt that spot earlier and you pointed out to me. You're going to
Yeah.
go right on top of them. The peak of your misalignment, the peak of Mount Everest, is where we're going to place that guy
yeah,
to undo and put pressure to undo we call it hyperkyphosis. So when you've lost your lordosis in your neck, curve isn't created or destroyed, it just changes places. So when we lose the curve in our neck, it goes into a kyphosis. So you can't induce lordosis unless you reduce the kyphosis. You follow me?
Yeah.
They're exchanged, okay?
Mhm.
So you'll reach a limit to how much curve you can get into your neck until you start removing some of the excessive kyphotic curve in your chest. And they need to be done together. There's, how much you can do this is limited by how much your head can come back. They're both
Yeah.
tied together. We call this coupled motion in chiropractic biophysics. They both happen together.